Got another good question. This time, somebody has asked about doing a Brazilian butt lift, which is a liposuction and fat transfer procedure to the buttocks, and they have a body mass index of 35 and submitted some photographs. Now, body mass index is a measure of height and weight, and it varies depending on those two factors. Over 30 is considered getting into the obese range. 35 a little higher, and then 40 is getting quite up there. Now, this is all relative because when you talk about a liposuction and fat transfer procedure, it matters as to how much fat is available and what does the skin look like. And with a Brazilian butt lift procedure, it's actually helpful to have a good amount of fat to take, especially if you want the buttocks to be made, moderately or substantially enlarged. There are other factors that go into that as well. The short answer is that a body mass index of 35 does not disqualify you from surgery. However, depending on any additional medical problems that you might have, it can be preferable to lose weight in some cases. But in this case, the patient has no other medical problems. And that being said, a body mass index of 35 is not going to be a contraindication for a Brazilian butt lift. But again, like always, I always recommend being examined in person, having a full medical evaluation by the surgeon to make sure that there's nothing else going on that would give any issues in leading to a successful outcome. So no, body mass index is not a factor that alone rules out a surgery, at least in my practice and in many others where the surgeon performs a high volume of procedures and is experienced in handling people of different medical backgrounds. You can even do the surgery up to body mass index of 40, and if you go over that, at least in the state of Florida, we tend to do it under local anesthesia only. When you get into a body mass index up to about 40, a lot of times we'll want somebody to lose some weight. And actually the factor that's more important is the way the airway is, and that's more of an anesthesia concern. But from a surgical standpoint, with a good surgeon that knows what they're doing and they are careful, body mass index alone does not rule out somebody for most types of surgery. So I hope that helps answer the question, and we will see you next time.